So the first that we're going to cover within this series of 3 videos of the overall sterilization area is receiving and sorting. So at the door that you see here, where a student from the clinic will bring instruments that have been used on a patient in clinic to the receiving door. When you receive your instruments, you must ask the student, is anything contaminated? Meaning anything inside the plastic kits. If there's anything contaminated, I'll talk to you about that later in person, what we do with those items. When you do receive, again, items from the clinic and you ask, is anything contaminated? And the answer generally is going to be no. You're going to grab the pen that is here, placed here at the receiving door, and mark off the unit that the items came from. In this instant, the items that you see before you are impression items, and they came from Unit 8. We have polish and fluoride items that came from Unit 1. So by checking off your list, this will determine what items were received. So I'm going to grab my items and I'm going to sort them. So the bowls would have been left on top because they are contaminated, and I'm going to place them in the sink with my Gleam 2 soapy water. I also have trays that would have been received that were used on a patient. We have the red labeled trays, which are specialty trays, and the blue labeled trays, which are located in the kits. These items go up in waiting. The trays go up in waiting in the little basket here, and they are sprayed with our ET foam. And again, I'm sorting. So my cassette that I received, I'm going to put it aside. This item, which I asked, is anything contaminated? No, it's not. I'm going to place that in sink number 3 on the opposite side without touching anything. Now I'm ready to check my cassette to make sure that all the items are there that I need. So I'm going to open it up. And make sure you open it up so that your blue little separators are on the bottom. Otherwise, everything's going to fall out at you. So I've got my 2 spatulas. I have here a size 15, which is a medium, small tray, and a 13 mandibular, and an upper 15 maxillary tray. So I have my small mediums, and I've got 1 medium tray. So which is the mandibular tray, by the way. So I would need to ask assistant number 2 from the clean side to go into the cupboard on their side and retrieve for me a maxillary size 13 tray and a mandibular and maxillary size 11 or 12 tray. And that way I would receive it, place it in the kit, close it up once I've received from the clean side my trays, and then it would go over to station number 2. I've received my polish and fluoride items, and again I would have asked, is anything contaminated? And it's not, so I'm just going to place it here and sort. So the items such as your big teeth and your toothbrush, they go into sink number 3 on the clean side or to the trolley. Since our sink is full on the clean side, we're going to put it on the trolley. Now you can't see me do this, but that's okay. We'll look at it after. The patient glasses, again, would go on the trolley along with our plastic sundries kits. So we're putting them on the trolley to hold them until assistant number 2 is able to disinfect the items. Again, make sure that your 2 bars, the color bars, are on the bottom so your instruments don't fall out at you. So I'm just going to open it up. I'm going to check to make sure all my items are here and that I don't have any garbage that should have gone in the general waste in the operatory. If you're not sure what's in your cassette, to check, on the cupboards you'll notice that there are color-coded labels that'll tell you what should be in the cassette. So if you look at it, it's green. It would be a green label on the cupboard to tell you what is in the kit. So I've checked everything, everything is there. So now I'm going to put it at station number 2 also. The handpiece that I received goes to station number 2. Now my bowls that I have in the water, my soapy water with Gleam 2, I'm just going to wash them up. You're going to rinse them off in sink number 2 and then place them at station number 2. Now, any items such as our ISO light pipette that comes from one of the units, you have cleaning utensils to use to clean the inside of the pipette. Now, the pipettes we clean in the sink because the hydrum would not be able to get inside the pipette. And once we clean the inside of it, it can then go to station number 2. And our cleaning utensils can be stored just in the basket above the sink. So that is, at the moment, receiving and sorting.